Welcome to high flow oxygen training to get familiar with a little bit with the Airvo2. As we all know, the indications for every item we got to use, here are the ones for high flow oxygen here. Hypoxemia, increased work of breathing, poor compliance with mask therapy, moderate to severe bronchiolitis, post-extubation requiring oxygen therapy, pneumonia, pulmonary edema, and atelectasis. Contraindications for this is as well space or skull fracture, cerebrospinal fluid leaks, tracheal trauma, severe epistaxis, as well as multi-organ failure and congenital abnormality of nasopharynx. As we look at the Airvo system, we have the heated breathing tube here. It connects right there and goes right up to the nasocannula portion right there. Connects to the pediatric one as well. And just there's no other adapters you would need for it. Down here will be the hot plate area, not to use for food. Don't do that. We have finger guard here, kind of helps allow the system of this reservoir to be able to go in there and stay locked in place. Make sure these pieces are lined up correctly and get locked right in there. This oxygen inlet port connects to the oxygen regulator, to which you would be able to adjust the FiO2 with. And there's another green piece there that connects the tubing to the oxygen itself, and we will show in the video after this presentation is complete. Once you have all those pieces hooked up, you're able to flow the oxygen as appropriately, which will be heated and then humidified from down here. It'll go up. This tubing right here connects to the sterile water. It's like similar to the IV bag kind of looking ones that is appropriate. It says just for inhalation only. It'll connect to here and it'll allow the water reservoir to go into here, and that is how the whole system will function appropriately. Monitoring for the patient requires cardiac monitoring, a minimum of 4-lead ECG, as well as SpO2 continuous monitoring throughout the entire transport with the patient. And as always, follow the same protocols for our vital signs as you see here: 30 minutes for stable patients, every 5 minutes for unstable patients. I have a quick reference guide here you can see, and all the buttons on here. The unlock for here, you press up and down together for 3 seconds will unlock the device for a setting you would want to do, whether it is the temperature if you try to change it for adults, or if you were changing the amount of liters per minute that's given. You can just hold those two when you're selecting on there. And then here's that 5 seconds holding the menu button, the mode button will change it to this picture of the bird, as well as the butterfly will give you the pediatric mode in there called the junior mode. It allows you to switch back and forth between the two. And when you adjust the parameters, you want to hit the mode button to move from temperature to your liters as well, and that would give you the ability to select that. And then you hold up and down for 5 seconds, and it'll switch you over to allow you to, or 3 seconds or say, to allow you to adjust the settings. When it comes to using the settings of the oxygenation for the FiO2, that requires the changing of the actual oxygen delivered on the device, the green tube setup. On there, when you change that, that will be a tricky little thing there, but I have a video that I'm going to create that you can see in detail. When you do set up the device, when it is complete and everything's ready to go, you will have this check shows up here. It just lets you know that you're ready to use this device as the appropriate settings and temperature. So for documentation purposes, we want you to go down here where you see the highlighted part there, and you can see it says all. Click on there to open up the next section. As you can see, the heated high flow is there highlighted. Go ahead and select that to move to the next section. As you're in this section here, just go ahead and fill everything appropriately. Make sure you fill the crew section of it, as well as crew member, date and time. It's going to be yes, because every single time is going to be on there. Go down, make sure it's fill a paramedic, the dosage, the temperature, and fill out the rest of the appropriate things down there. When you get to the very bottom, there's going to be a section where it just says on scene, protocols. Click on protocols, and then go ahead and hit OK. That is it for the training. If you have any questions, go ahead and contact me or any of the management. We can help you out with that. There'll be a video to follow with a very detailed portion of how to appropriately use it. Thank you for your time.